the patient was from Philippines. She was suffering from avascular necrosis, last stage of AVN, with secondary osteoarthritis.
The first doctor she went to, she's a lady doctor, and she told her that the only way to cure is surgery.
Right.
So my wife didn't want surgery, so
Because 1 week treatment, so painful. I thought I cannot heal anymore. But now, I healed already. After 10,
Okay.
10th day.
well, I also read about the Ayurvedic medicine, so about Ayurveda. So I said it's another option.
Right.
You take the Ayurvedic medicine to try to maybe we have some hope of curing my wife
Right.
without any
Without
incision, operation
Right.
or replacement of the hip. So
Okay.
I thought it's a very good method of treatment.
After my consultation, what was your experience?
You give me hope.
Right.
Yeah, you give
101% hope.
Okay. So earlier, what was the condition?
you earlier. What's your
It's very hard. It's aching. I said,
It's painful.
it's painful. So painful.
to step inside the
Step
car.
inside the car. Now, I went to the X-ray center. Then I ride in the car. It's easily.
Step-
I surprised.
So hello everyone, this is Dr. Avinash Singh Chauhan, Senior Sitting Doctor, Shiva Hospital, and a specialist in Ayurveda, AVN spine and joint related disorders. Friends, today we are sharing a very interesting story. The patient is from Philippines. So now directly moving towards the patient side, the patient was from Philippines. She was suffering from avascular necrosis, last stage of AVN, with secondary osteoarthritis. You can understand the critical situation how she was facing since last many years, and her name is Luz. She's from Philippines. Both belongs to Philippines. They are couples. Yes, couple. And now just moving towards directly towards the patient side. So tell me your name.
I'm Lusui from
Luz.
Philippines.
Okay, and what about?
I'm Antonio Uy from Philippines.
Okay, so how did you find us about our hospital, about me?
Well, my wife was suffering from AVN, so I searched Google AVN and went to YouTube
Right.
and searched for AVN treatment, and it came out that one video belongs to
Oh, first time when she diagnosed with the disease like avascular necrosis and arthritis. So you consulted to many doctors to your place, right?
We
So what
consulted
was your experience about what they said?
Like injection.
Yeah, the first doctor she went to, she's a lady doctor, and she told her that the only way to cure is surgery.
Right.
So my wife didn't want surgery, so we went to another doctor
Right.
who was performing PRP.
Injections,
of stem cell and
In your place, like Philippines, huh?
yeah. So well, after sometimes 6 months of injection, nothing is improving, and she's
No
still
progress.
feeling no progress. She's still feeling the pain in her heel. So that's why I made a research on the internet, the Google and the YouTube, and we found you on the Google and YouTube. So I watched your videos.
Okay.
So I thought this is a different treatment. It's an Ayurveda treatment.
Right.
It's different from all other treatment. So
Correct.
it should be. I thought it should be very well because there's no injection, there's no cutting
Right,
or
right.
whatever. So replacement of it, it's entirely healing process through Ayurveda technique and medicines.
Right. Correct. So, at that moment when you found us, right, avascular necrosis treatment in Shiva Hospital, Dr. Avinash Singh Chauhan, you find in YouTube, right?
Yeah.
So, at that moment, what do you think like about that? Ki this is the best place, so that in this place I will cure my disease. That was the thing. Thoughts?
Well, I also read about the Ayurvedic medicine, so about Ayurvedic. So I said it's another option.
Right.
We take Ayurvedic medicine to try to maybe we have some hope of curing my wife
Right.
without any
Without
incision,
operation.
or
Right.
replacement of the hip. So
Okay.
I thought it's a very good method of treatment.
Right.
It's a very ancient,
And yes, correct.
very ancient medicine.
Procedure, treatment.
Yeah. So India is a great country, very long.
Thank you so much. Thank you
Ancient.
so much.
So that's why I tell my Indian friends, oh, you should be proud of your
Correct.
culture. Huh? Your civilization is among the oldest civilization in the world.
Right. We all are having proud, like we are Indians
Yeah.
because we belongs to this country, and all the cultural activities, all the things like it is a very classical way. It is in India. It's only in India happening.
Yeah.
Like in other countries, it is not like that.
Yes.
First see that you found us, then after that we did online consultation, right?
Yeah.
Like over Zoom.
Yeah.
So what about what was your experience after Zoom meeting, like over the consultation to me?
Well, after the Zoom, we thought about many times and also wanted some assurance of how many percentage of recovery.
Right.
And we found that many patients are fully recovered from that.
After my consultation, what was your experience?
You give me hope.
Right.
Yeah, you give
101% hope.
Okay. So
So
what?
we decide to come.
Okay. That is why after that consultation you decided to come to
Yeah.
my place, like for treatment.
Even it's too hard for me to travel.
It was very difficult. Like
Yeah.
very difficult because
Because of my situation.
I want to tell you about her story. Like when I consulted her, so at that time she was on wheelchair and she was not able to walk at least 1 or 2 steps. Right at that moment when I started, because over the Zoom call, I saw her movements. She was in very critical condition at that moment, at that time. So then I decided, and I already said to you, she was suffering from last stage avascular necrosis with secondary osteoarthritis. So I want to share you the condition of the patient when I started the treatment. Now this was a recent earlier X-ray when I started. You see, you are news 23rd, I guess 25/4/2023. That was her first X-ray. After that X-ray, she came to my hospital. Now you can see the condition of the right hip joint. It was totally fused, and the left one it was in good condition, but right one there is no space. Ball is totally collapsed at that moment. After that, she came to my hospital. That was the first X-ray. Now you can understand the critical situation or how she was suffering from since last many years. So that was the condition that I said to you in the starting time. So now, how much you satisfied from this treatment?
I'm so satisfied, 100%.
Okay. So how much improvement you got from this treatment? Like earlier, what was the condition, and how much improvement you will just? Can you tell me your story about the what was your
When she
situation?
was not able to walk very far and sit very long. So after this medication, she was able to sit now very
Good.
time. So for so many minutes.
Now I saw now you are able to walk also. Like earlier it was very critical situation, and that was the scene. I was little bit worried how much improvement you will get from this hospital, but you recovered a lot, and I am very much happy from this. You are in very good condition right now. So, you are able to lift your leg. Now you can sit in the car and all.
Yeah.
Right.
I can sit in the car.
Earlier, what was the condition?
Easily sit in the car.
Okay. Earlier, what was the condition?
You earlier, what's your
It's very hard. It's aching. I said,
It's painful.
it's painful. So painful.
to step inside
Step
the car?
inside the car. Now I went to the X-ray center. Then I ride in the car. It's easily. I surprised. I surprised. My feet is easily went in the car. Sit
So
in the car.
that is a new thing for you.
When I'm sitting in the car, I think of you.
Thank you so very much.
Yeah.
How difficult it was to travel from Philippines to India.
Yeah.
Can you share your story from Philippines to India?
My
What difficulties you faced?
so painful. I'm suffering for the painful of my back
Okay.
and knee.
So from our
Numbness.
from our place,
Place.
we
Travel.
started at 3 a.m.
Okay.
and come to the airport, and it took us almost more than 10 hours from Philippines to Thailand.
Okay.
Then from Thailand to
India.
India.
From
Again,
India to
another
my
10
place.
hours.
Yeah, again,
Right.
10 hours.
20 hours.
It's almost 20 hours of
My-
travel. So that's how she
Painful.
suffered during the travel time.
Okay. So is there any cut and injections? We did it here
No.
during the line of treatment.
There's no injection, only cupping
And
and
cupping.
massaging and steam.
Steam.
Okay.
Very
And,
good.
And the manual treatment was there, right?
yes,
So, how different from Philippines to India? How you travel? If somebody is trying to come to my hospital after this video, after your words, so how they will try? They will plan to a journey.
I think they have to take that same route, same plane from Philippines to Thailand, because there's a direct flight from Thailand to Lucknow.
Right.
So other planes, they have to pass by New Delhi,
Right.
to Lucknow
Now to hospital, right?
hospital. So that's the shortest time.
Right.
So they have to check that shortest.
Is there any problem you faced during your journey?
No problem.
Since the support was there, the hospital support was there.
No problem.
The problem, everything was fine.
Yeah.
Okay, and from Lucknow to the hospital, there was one person was there to receive you,
Yeah.
Yeah, there's a person who is Aman.
right? From hospital side, right?
Yeah.
So you didn't face any type of issues from traveling from Philippines to India, right?
Okay.
Okay, so
But they have to, before coming, they have to talk to you first, and how they.
right. Means firstly the patient who's trying to come to my hospital, firstly they have to talk to me, right?
Yeah.
And after that the procedure they will go on, that they can plan accordingly.
Okay.
Okay. So, what surprised you most about my practice? What surprised you most? in the videos
I
that
am surprised.
I didn't expect I will heal.
She did not expect he will be healed.
Yeah.
and you saw I think lot many videos of mine, right? You saw lot many videos of mine in my YouTube.
Because 1 week treatment, so painful. I thought I cannot heal anymore. But now, I healed already. After 10,
Okay.
10th day.
Means
There's an improved progress.
in the starting days
Yeah.
you faced little bit difficulties like
Yeah.
walking and pain was
Yeah,
there,
yeah.
but after 7 to 8 days you started recovering, like.
Yeah.
So
Continuous
at that
treatment.
moment you felt like, I can heal myself like in this way.
Yeah.
I think you were revising my thoughts,
Yeah,
like
yeah.
my tagline, like I can heal myself in this way, right?
Yeah.
So that's correct, and it can happen to each and like the conditions of the patient, because everybody is suffering from different type of conditions. The recovery and the results is depend on the patient conditions and the body response also. So that is the reason. And now I am just going to show you the recent X-ray of the female patient of Luz from Philippines. So now this is the recent X-ray. Now earlier you saw the condition of the patient, like you can see. This was the condition. And right now, earlier there was no space in between the cavity and the ball. You can see here. Right now, you can see here, this is the recent one X-ray. Now you can see the spaces. Ball, and there is a space in between the cavity and the ball. And the pelvis, earlier it was upward, it was downward. Right now it is equal. And one more thing, she was suffering from knee joint also, knee joint pain, like arthritis. Now this is the recent one X-ray. It is in very good condition. Now knee joint is in very good condition, like the younger people, like it is looking like a younger people. Like you can see the spaces, a healthy spaces in between the joints. You can see here. And here also. This is a recent X-ray of the spine, here knees, hip joint. So why I am showing you all the X-rays, because when I started, she was suffering from knee joint pain, both bilateral side. She was suffering from hip joint, avascular necrosis, arthritis pain. She was suffering from a spine problem, like backache and the spinal pain, and it was going towards the legs, like radiculopathy was there. So that was the changes, like she felt day by day when I started the treatment from the first day up to the last 10th day. How much you satisfied about this hospital, like about this treatment?
Very satisfied.
Yeah.
Very
Satisfied.
We highly recommend that those who are suffering from pain in the joint, the hip, and the back pain, you could come and see Dr. Avinash and consult them.
Thank you so much. Thank you. And any message would you like to share to your Philippines patient?
Yeah, I mean, Dr. Avinash is very confident when we came here, and she told us that he can heal her condition. So you are very confident in your profession.
Thank you.
So that's what we appreciate from, because of your confidence in treating the patients, making patients recover from their pain and all those affected by this AVN. So many people are affected by AVN. Every day, non-stop patients coming
Right.
for treatment.
Right. Thank you so very much for sharing your kind experience here. And surely I said to you like earlier that I will give my 100% to your case as I did it. And right now she's feeling very well, and the changes that is showing in the X-rays also. And in the symptoms, she's feeling very much comfortable. And now from here, she will follow all the instructions as I given to you. And before that, so that you have to continue the same things in your next couple of months. After that, if is there any like if you want to talk to me, so I will be there always. you can connect to me directly through my over the Zoom calls, and I will be there. Okay, so thank you so very much, all of you. This they both are very very charming, and they both were very cooperative, and I just want to tell they are made for each other. Thank you so very much, all of you, for watching this video, and maybe it will be very helpful for the patient who is suffering from the joint disorders, and it will be very motivational for the patient who is in last stage. And I think this video will give you the hope. Thank you so very much. Wish you a good health, and namaste. Thank you. Thank you.